Testing, tracing and vaccination. Prime Minister Hsien today outlining the next phase of Singapore's COVID-19 strategy moving forward. Given the increasing prevalence of the more infectious virus strains, Singapore will ramp up 3 aspects of its approach.
What does the more infectious virus mean for our fight against COVID-19? It implies that we must continually adjust our strategies and raise our game to keep COVID-19 under control. Specifically, there are 3 things that we have to do more of and do faster: testing, contact tracing, and vaccination.
Professor Ying joins me now to weigh in on Singapore's COVID-19 situation and today's announcements. Now, he's the Dean of the Swee Hock School of Public Health at the National University of Singapore. Welcome back, Professor. Professor, we have lots to discuss, but let's focus first on the shift in approach to testing. Now, your thoughts on the scale and speed to which testing will be carried out. Now, PM Lee said testing will not only be to identify infections when new case pops up, but also routinely and regularly test people who appear well.
So thanks for having me on. Indeed, a lot to digest and to go through today, but I think we can start to see a roadmap emerging, a roadmap towards moving on in our lives on how to live with COVID-19. I think so far many countries have actually used testing as a way to identify who have been infected and then to take action against these infected people and to quarantine those who have been in contact with these infected cases. Now the strategy has changed to much more routine screening and routine testing, and not just of people in the high-risk sectors such as the migrant workers living in dormitories, the frontline workers at the airport or in healthcare sector, but actually to move towards more routine testing in the population, even allowing people to test themselves with DIY test kits that you can buy over the counter in pharmacies. The rapid antigen test or the antigen rapid test, as well as the breathalyzer test, is really a fraction of the cost when compared to the PCR test. And we can actually test more people repeatedly without necessarily costing more. And we have always said from the beginning, the ability to test widely is key to detecting any hidden infections in the community and to keep the COVID-19 situation under control. And now we are actually taking a very concrete step towards achieving this.
Professor, let's talk about the DIY tests which you mentioned. We will soon be able to purchase these DIY test kits over the counter at pharmacies. Now, other countries have these self-administered test kits readily available. How do these DIY tests work, and what sort of operating procedures need to be in place to ensure accurate reporting of results?
So at this point, I think it will be important to wait for more details on how the DIY test will be reported. But I suspect this is actually meant more for personal peace of mind, rather than to be integrated with a national reporting framework that once you test, you go online and submit the test results. I don't think that is actually the case here. I think what is more important, it's for people who see a positive test when they test using a DIY test, and to come forward and report to MOH that they have performed a DIY test and saw a positive test result, and they need to go for a confirmatory PCR swab test. So there may be more false positives or scares where a healthy person may end up with a positive test. But the PCR swab test will be the test that will be used to confirm is a person truly infected. So hopefully the false scares will only be for a couple of days, and people will get a confirmatory test afterwards. So I suspect there will be some kinks in the beginning as we start to roll out using this DIY test. And I don't think we will get it right from the beginning, but I suspect this is going to be part and parcel of what we have to do to learn to live with the coronavirus.
Let's turn now to tracing. Again, the emphasis here is on working fast and casting the net wider. So, Prof, in other words, Singapore has to get even better at contact tracing.
Yes, and to be very honest, I actually think that Singapore's contact tracing is already very, very good. Worldwide, many countries still look to Singapore to learn how we have carried out our contact tracing. But what has changed is actually now our intention to isolate household members of first-degree contacts. And I think this needs a little bit of careful explanation. So perhaps bear with me here. Suppose I am the infected person and I have been in physical contact with you, with Olivia, and a few other colleagues in the School of Public Health. So all of you are my first-degree contacts. And normally, that means that all of you will need to be quarantined. And there's no impact to people staying in your household. Now, not only will you be quarantined, but all of your household members will also need to be isolated. And this actually improves the efficiency of contact tracing. It will certainly bring about more disruptions to households. But the reason why we need to adopt this now is that we are facing new variants which are much more transmissible, where the incubation period can actually be as short as 1 or 2 days. And so household contacts may also be infected and be contagious before contact tracing can actually catch up. So by now extending this to household members of the first-degree contacts, we actually speed up and increase the efficiency of the entire contact tracing process.
Let's look back on an interview which you had with us, Professor, on May 14th. During the interview, you said that the spread and speed of the infections in the community are happening faster than our contact tracing and isolation protocols. Before we can even intervene to cut the transmission chain, I want to ask now, 2 weeks into our phase 2 heightened alert period, how are we progressing on that front?
So this is one of the most popular questions we have received recently. And I actually don't want to jinx this, but presently I think there is indeed encouraging and positive signs. So a couple of weeks back, we were looking at 20 plus, 30 plus community cases daily with more than 10 unlinked cases each day. But right now, what we've seen is that over the past few days, the numbers have indeed come down, especially the unlinked cases. So we are still seeing maybe between 3 to 6 unlinked cases every day. But it's clear that the restrictions that we have put in place have worked to prevent the situation from spiraling out of control. Because if the restrictions have not worked, the numbers would certainly have grown a lot more, possibly even in the hundreds already. And this is really something that we have to credit the sacrifices and the cooperation of many people in Singapore, since I can see people trying to minimize their movements in public. And this has also, of course, caused a lot of pain for retailers and eateries. But barring any surprises, I think we should see the trend continue to decrease, as what Prime Minister Lee have mentioned.
Professor, more segments of the population, if eligible, can now get vaccinated. We're talking about students, pregnant, as well as breastfeeding women and cancer patients on active treatments as well. Now, your advice for these groups of people who may still have doubts or even fears in getting vaccinated?
So let's look at the issues around vaccines. We've always talked about vaccines from two perspectives. The first is around safety. And we have talked about the normal anticipated side effects such as soreness, mild fever, fatigue, versus the more serious adverse events. And we have seen that the data from Singapore shows 4 serious adverse events out of every 100,000 doses, or 0.004%. Not 4%, not 0.4%, not 0.04%, but the figure we're looking at is 0.004%. This really highlights that the serious adverse events are very, very rare. And that's on the safety part. What about on the effectiveness part? I think either Singapore has been extremely lucky, or the people in charge of reviewing the different vaccines in early parts of 2020 last year, when they were looking at what vaccines to purchase, they were very astute or placed the right bets, because the 2 vaccines that we currently have in Singapore, the Pfizer-BioNTech vaccine and the Moderna vaccine, are amongst the most effective vaccines available against COVID-19, even against the new variants that have emerged from UK, from South Africa, or from India. There are also vaccines these are also the vaccines that until today have not been associated with other serious side effects such as the blood clots that we have seen in other vaccines. So I think it's important to realize that the vaccines we have now for Pfizer and Moderna are not just effective, but they are also amongst the safest vaccines. And I think it's also important to highlight, now we are extending not just to the regular adults, but we are also extending it to pregnant, breastfeeding, cancer patients, and previous people with scars, as well as also potentially to children. I think it's useful to highlight to everyone that as of 28th May, US alone, the United States, have administered more than 157 million doses of Pfizer vaccine alone, and more than 123 million doses of Moderna. In Germany, we see more than 36 million Pfizer doses, more than 4 million Moderna, about 4 million Moderna doses. So these are two countries that constantly monitor the side effects profiles very carefully. And it is really through learning from all the experiences from other countries where millions, hundreds of millions of doses have been administered, that we start to see who are the people who can receive the vaccine safely. And that is what we have learned and what we are rolling out right now to the public.
Professor, PM Lee said earlier as well that barring another super spreader event or big cluster, restrictions should be relaxed after June 13th. How possible is that, you think? And given the better testing and tracing capabilities as well as the ongoing vaccination program, what sort of gradual reopening would we see? Still something similar to the one last year, post-circuit breaker. Now, the task force did say that it's quite unlikely that we will revert to phase 3.
Yes, indeed. I think we will be very careful, as always, to reopen in phases like what we have done last year, maybe allowing some dining in to resume, but likely to require most people to continue working from home if possible. And the key is really for our vaccination rollout to speed up, because we have relaxed the restrictions before we relax the restrictions more. So if our vaccination rollout is able to be faster, because the vaccines are coming into Singapore faster, then I actually do believe that the country will be in a better state to lift our restrictions quicker.
Looking ahead to the new normal, now PM Lee said he does not expect COVID-19 to disappear. It will remain with humankind and become endemic, with the virus continuing to circulate in pockets of the global population in the coming years. Professor, could you help us paint what this new normal will look like in terms of Singapore's public health policies and even on the individual level as well?
Actually, I think at this point it's useful to think back to what has happened with polio, with measles, with mumps, with whooping cough, which we also call pertussis, diphtheria, and tetanus. These are some of the infectious diseases that the world were grappling with many decades ago. And I suspect many of these diseases are what younger generations of Singaporeans may not have heard about, but they would already have received the vaccination against these infectious diseases. But these were exactly the kind of problems that used to plague individuals and communities and countries many years back. And I suspect this is going to be what will happen with COVID-19 as well. That right now we are in the midst of it. That's why we feel the trauma, the pain, the worries with an infection like COVID-19. But vaccination is very likely to be the solution that will take us out of this, because once we have more people vaccinated, perhaps this will be an annual vaccination, like very much some of our vaccinations that we roll out. When we have enough people vaccinated, we will be able to relax our measures, because even if I'm vaccinated and I get infected when I'm vaccinated, my symptoms are likely to be mild and very unlikely to require hospital care. And that means that we can now lift a lot of our restrictions, perhaps even resume some degree of travel to places where the degree of vaccination in those countries are similarly high. And I think that would be the new normal that we're looking at, relying on vaccination with some public health measures that will still be in place to make sure that we minimize the risk of transmission if indeed someone is infected but asymptomatic.